All right, deep breath in, all the way out, nice and loose. Yep, good. And then go ahead, deep breath in, all the way out. Good, right through there. Yep, good. Hey everybody, this is Dr. Brady at Kalkstein Chiropractic, and I'm with the one, the only
Christian from Kalkstein Chiropractic.
And Christian here is out on the exercise floor working with patients with the FSP program, other rehab phases that we have. So he's a nice addition to the team here. Yeah, because you're just starting, right?
Thanks, man. Yeah.
No, I was kidding. All right. No, but all right. Today we're talking about sciatica. So that's a very popular term thrown around in not only the chiropractic profession, physical therapy. So what is sciatica, Christian?
Sciatica is often shown and shows itself through radicular pain coming from the lumbar spine that can sometimes shoot down your leg, cause any numbness, nerve irritation, generally stuff that's shooting down the legs. That's one of the most common signs that we experience here from patients.
Yeah, and he hit the nail on the head there. Another area of entrapment for sciatica is that piriformis. So that's the muscle that goes from your sacrum all the way to your hip there. So the sciatic nerve runs right underneath that piriformis. So if there's any irritation to that muscle, it will start to compress on that sciatic nerve, and that's when you have that glute pain with that radiation all the way down to the foot there. So Christian, you have sciatica today, okay? All right.
Absolutely, for video's sake. I am down bad.
All right, so left side sciatic, and we see it in injuries, like Christian said, lumbar spine, irritation of that sciatic nerve. So we're going to do nerve flossing here today with that sciatic nerve, and I'm going to do a pin and stretch technique to the muscles surrounding that sciatic nerve. Okay, so we'll start with that pin and stretch technique here today. We're going to go ahead and go face down here then, Christian.
Sounds good.
Well, Christian and I are pretty much on cloud 9. By the time this video goes out, it's probably going to be, pretty deep into the NFL playoff season here. But Christian's a Rams fan, I'm a Steelers fan, so both teams made the playoffs. So shout out to them, and best of luck to you in the future there, Christian.
Absolutely.
All right. So like I said, that's that piriformis muscle runs from the sacrum to the hip here. So I'm going to be using my elbow as compression to that piriformis, and then I'm going to use Christian's leg here and passively go throughout the motion. So as I'm adding pressure right through here, I'm passively taking his leg and hip into internal rotation. Good. And do you feel that right through there, Christian?
Absolutely.
Okay, good. Let me know if it ever goes above a 7 out of 10 on the intensity scale.
Got you.
So as I'm going, I'm kind of palpating with my elbow here and doing a light scan to see where he's holding most of that tension. And for Christian, it's up a little bit higher. So I'm going to get a good angle here, do 2 more passes. Good. 1 more. Good. Okay. And not only is pin and stretch a good modality or technique that we use here at the office, for piriformis syndrome, if you have that entrapment at the piriformis for that sciatic nerve, we would use dry needling. That basically would go through all the glute musculature and into the actual piriformis itself to relieve that tension there. And then Christian, I'm going to go ahead and adjust your TL junction here. So if you can go ahead and look straight ahead there for me. Deep breath in, all the way out. Good. Good. Just like that. I'll bring you on up. All right. So right through here. Go ahead and cross on up there for me, please. That's all right. Deep breath in, all the way out. Nice and loose. Yep. Good. And then same thing on the other side there for me. Good. And then go ahead, deep breath in, all the way out. Good, right through there. Yep. Good. Nice. And then on your back there for me.
Like a rotisserie chicken. Word.
All right. So you guys are probably tired of me talking about sciatica and all the symptoms. So I'm going to let Christian here go over one of his probably go-tos, right, for sciatica, the nerve floss.
Oh, absolutely.
Okay. Do you want to take the camera through it there?
Oh yeah, absolutely. We can do this right here. Yeah, could you hold this mic
sure.
right here, bro?
Sure.
Awesome. So, sciatica is obviously, as Dr. Brady has mentioned, one of the most common things that we deal with in rehab on the exercise floor, and used in conjunction with the treatment that you will experience here in terms of adjustments and modalities. We are avidly teaching nerve flossing throughout the week. And with sciatic nerve flossing, I would just give it more like a side angle right here so I can give a little better view. So you're going to, the side that is experiencing the nerve pain going down the leg, you're going to pin to your chest so grip right under your knee on your thigh, and you're going to bring this up, and from here, you're going to bring your ankle up, think toes to the nose, and you're going to extend up as you're keeping that pin to your chest. Once you get to the top, you should pretty much feel the tension going down your leg. You're going to do nice little 3 pumps right here, and then keep that toes to the nose as you come down. You're going to do this for about 2 sets of 10, and you're really going to start to feel that kind of fire up a little bit. And it's going to be a little tender as you're doing these, but it's all for the betterment of kind of flossing those nerve pathways and relieving some of that irritation and tension sitting down there.
Nice. Sounds
Thank
good.
you, sir.
And as far as reps?
2 sets of 10. I wouldn't do it too many times throughout the day, because you can, like I said, it's most commonly you get a little bit of tenderness in the area, a little bit of irritation, but that is very natural because you are quite literally flossing your nerves.
Yeah, absolutely. Nice you said. And it also does depend on condition, when the injury happens, stuff like that as well. So just to recap the video here, what is sciatica? It's any entrapment to the sciatic nerve, or any irritation to the sciatic nerve that will cause that numbness and tingling to go down the leg. It can be sharp and shooting. Burning is another typical symptom we hear for sciatica. It can have multiple entrapment sites. So Christian here talked about the lumbar spine. I talked about the piriformis there. There's a couple others, but those are the 2 most common. And then, treatment from a treatment standpoint, pin and stretch technique, and addressing the soft tissue musculature around those entrapment sites can relieve any tension to that nerve. Dry needling and shockwave therapy are 2 other modalities that we use here in the office to decrease that tension. And then, obviously adjustments as well. And then at-home exercises. We showed you one here today that we like to start people at, and then we develop more of a rehab-focused, whether it be low back and core strengthening or posterior chain exercises.
Absolutely.
Yeah, to help out with that condition. Okay? So if you or someone that you know have sciatica, stop on by in the Towson location here at Kalkstein Chiropractic.
And you will be blessed to see our fantastic crew here, including Dr. Brady and I, and we will be blessed to see you here, most importantly.
Crushing it. All right, see you guys.
Have a good night.